When it comes to our health, many Americans get caught up in the numbers game. How much do I weigh? What's my blood pressure, blood sugar, cholesterol, my odds of beating this disease or that condition? All good things to know, but maybe, just maybe, we should focus on a different set of numbers. What's my annual income? How far did I go in school? And here's a good one. What's my zip code? Why are these numbers so important? Because they reflect a set of so-called social determinants. Poverty, race, education, housing, environment, and public safety among them, that play a far greater role in our health than we think. At a time when Americans' per capita expenditure on health care is #1 in the world, but our life expectancy falls back in the middle of the pack, it's time we take a hard look at our nation's health, a focus on social determinants. And welcome to our program, Our Nation's Health, a focus on social determinants. I'm John King. Let's get straight to our conversation because this is a fascinating topic and we have a fabulous group to discuss it with for our program. Dr. Thomas Ellison, I want to begin with you, sir. You've traveled this country and you've traveled the world. Let's get into the definition of social determinants. Also, when we look at this country, it's 50 states. We have urban, we have suburban, we have rural. Tee us off with the conversation by giving us your definition of what we need to talk about here.
I think that I would include the things that have been mentioned, like race, poverty, environment, housing, lack of proper access to health care, delivered by someone who's sensitive to you as an individual, with you being an equal partner in your health care treatment and options.
And how conscious are the people themselves? So you're talking about the providers might need to be conscious of this, but what about the individuals themselves? Do they get that?
Some do and some don't, and that comes to my personal social determinants: education, spirituality, as well as quality access.
Quality access. I want to come to this end of the table. Kathy Ko-Chin, you're the president and CEO of the Asian and Pacific Islander American Health Forum. Take that question and that challenge into the community you deal with, and both the challenges and opportunities.
For many in our community, there's the mistaken impression that Asian Americans are healthier than everyone else, or richer than everyone else, or have higher educational attainment. But in fact, when you really separate out different communities from different countries, you can see that there really are large differentials. We also have a lot of different health challenges, such as 5 times the rate of cervical cancer in Vietnamese women that as compared to white women, high rates of diabetes among Pacific Islanders, and then over half of the people with hepatitis B are Asians. And all of these things are preventable or treatable if there's access to care. So the question that Dr. Ellison spoke to, which is about access to care, really is a huge issue in Asian American, Native Hawaiian, and Pacific Islander communities. That's around language access and immigration status.
Dig a little deeper. You mentioned immigration status. A lot of your community are immigrants, some recent, some not so recent. Address what I might call the paradox. They see the Statue of Liberty, that's arc, and they come here thinking they're going to get a better life. I assume by better life, their definition would be better health.
Yes.
Is that necessarily what they get?
Not necessarily. So in many immigrant communities, not just Asian American, but also in Latino communities, there is an immigrant paradox, which is you come to this country and you have generally better health, but over time, both generational but also over the years that you live here, you acquire the same conditions, the health conditions that average American has: obesity, hypertension, diabetes, and a lot of that is because of the other factors, not just care, but really lifestyle factors.
Gail Christopher, you from the W.K. Kellogg Foundation in Battle Creek, Michigan. A lot of your work is out in the community. It's outreach, it's trying to engage people. Explain why. I think a lot of people, perhaps maybe the more educated that don't have these challenges, would think, why do you have to reach out to people about the most basic fundamental issue of their life, taking care of themselves?
Well, really, if we take a social determinants lens, those factors that determine well-being are community factors, whether it's housing and the quality of housing, the exposures to lead, the food, the access to quality food, the quality of the air that one breathes. These factors come together at a community level. And in a democratic society where citizen participation is the key to change and to resource allocation decisions, you have to really have communities organized and willing to stand up for the changes that they need to see take place